Good evening and welcome to the Board of Health public hearing. This is for the nicotine-free generation regulations. Thank you for coming. If anyone is interested in any of the tobacco handouts, they are located at that station there along with the proposed regulations for tonight's hearing. This public hearing is televised. The following is the purpose, order, and conduct for the hearing. The purpose is for the Board of Health to receive information upon which to base its decision from interested citizens and residents to execute the nicotine-free generations regulation. The Board will hear comments from those in support or opposition, if any. After comments are voiced, the Board will address any concerns or questions, if any, and will request for additional comments or questions that are not repetitive. The Board will discuss as to the need of any additional information, if any. The Board will announce its decision, if any. The Chairman will request a motion to either continue or close the public hearing. The Board will entertain a motion for a vote, if any. The following is the conduct for citizens and residents. Each person must identify oneself. Each person may speak only once in support of opposition or in favor. All comments and questions must be addressed to the Board of Health. If there are questions, they will be noted by the Board of Health, who will determine those which it finds pertinent to the matter. The Board of Health Chairman may limit repetitive comments. So if anyone wishes to come and voice their comments, please do so by standing up at the microphone and announcing oneself.
Good evening, everybody. My name is Scott Francis. I live in Ashland, Massachusetts, so I'm not a Hopkinton resident. I work for Massachusetts Organization for Addiction Recovery, and I am a person in long-term addiction recovery, mental health recovery, and trauma recovery. I never would have started smoking cigarettes if they haven't been given away. I was actually hospitalized against my will in 1995 at Pocasset Institute, and they passed out cigarettes 2 at a time. And unfortunately, I became addicted to nicotine, and it really had a negative impact on my life. I smoked from 1995 until 1997 when I quit the first time. And then I had a return to use in 2000, and that return to use lasted 6 years, and it greatly impacted my life. And also, it's been the most difficult addiction I've had to overcome. I used alcohol and marijuana, and when I had my first return to use from alcohol, it took place in 2006 after 10 and a half months of sobriety, and I was able to, just after a weekend, go back to AA, or a 12-step fellowship, and return to my recovery. And I had one more night where I used alcohol, and I hadn't had a drink since September 22nd, 2007. So as you can see, that return to use from alcohol didn't last nearly as long. And the return to use from nicotine, it lasted for years, 6 years, thousands of dollars. It affected my health. And so I am advocating to have a nicotine-free generation. I testified in Concord and at that hearing, and they voted to support not selling tobacco products in Concord. So I'm asking this board to consider to have do everything we can to prevent people from having access to a product that hurts people, a product that kills people. And people who do want to use that product, there's many ways of getting that product, but let's make it as difficult as possible for young adults. I have 2 children, ages 8 and 11. I hope they never pick up that first sucker drug, because nobody knows where it'll take them. So I ask you to support this, to prevention is real important. So thank you very much.
Thank you, sir.
Go Celtics.
Anyone else?
So my name's Erin Bartolini. I am the Drug Free Communities Coalition Coordinator here for the town of Hopkinton, and I'm going to read a letter of support from Hopkinton Organizing for Prevention, which has been signed by many leaders in our community. So to the members of the Hopkinton Board of Health, Hopkinton Organizing for Prevention is a community-based coalition dedicated to preventing youth substance use and promoting wellness. Founded in 2015, in response to the opioid crisis, HOP has grown into a strong, multi-sector coalition representing youth, parents, schools, businesses, law enforcement, healthcare, local government, faith-based groups, civic organizations, and others committed to prevention. Our mission is to collaboratively prevent youth substance use by providing resources, education, and support that build resilience and promote well-being across our community. We are writing to express our full support for nicotine-free generation policy, a proactive and forward-thinking initiative that aligns with our values and mission. By preventing early nicotine use, this policy supports lifelong health and helps protect Hopkinton youth from long-term addiction and chronic illness. Insights gleaned from the 2023 Metro West Adolescent Health Survey, as well as recent Hopkinton Middle School and high school focus groups underscores nicotine use is starting at young ages. This trend elevates the risk of substance use disorders and heightens susceptibility to chronic ailments such as cancer, heart disease, and respiratory disorders. The science is clear. Vaping during adolescence can disrupt brain development, cause respiratory health hazards, and lead to long-term addiction. Youth-focused marketing and affordable product pricing only make these harmful products more accessible. The trajectory for nicotine-free generation policy is a critical step toward changing that trajectory. By championing the nicotine-free generation initiative, we signal our unwavering commitment to safeguarding the health and future of our children. We stand poised to take proactive measures to ensure that our youth grow up in an environment free from the influence of nicotine. As a coalition, our mandate extends to safeguarding all aspects of our youth's health, including shielding them from the harmful effects of nicotine. This policy resonates deeply with our mission of promoting health and enhancing the quality of life for Hopkinton residents. We urge the Board of Health to endorse this policy and stand with us prioritizing the health and future of Hopkinton's youth. Together, we can take meaningful action to prevent addiction, promote wellness, and ensure that every young person in Hopkinton has the opportunity to thrive. And this letter has been signed by many members in the community, notably the Chief of Police, Joseph Bennett, Lieutenant Aaron O'Neill, Officer Matt Santoro, the School Resource Officer, Carol Kavanaugh, our Superintendent of Schools, Abigail Hanscom, the Director of Student Services, Paula Venetian, the Medical Home Care Coordinator for Main Street Pediatrics, Jim Cousins, our HCAM Station Director, Bart Pinchuk, Executive Director of the YMC Outdoor Center, Reverend Sarah Schneider-Watson of the Vineyard Church, Neha Ninan, who is a senior at Hopkinton High School, Sean McAuliffe, our Health Director, Simone Carter, our Public Health Nurse, and Gail Levine, our HOP Chair.
Thank you.
Good evening. I'm Bart Pinchuk. I'm the Executive Director of the Metro West YMCA Outdoor Center here in Hopkinton, 45 East Street. And thank you for allowing me to speak in support of the nicotine-free generation policy. At the YMCA, we are deeply committed to youth development and healthy living, values which align well with the goals of this policy. As you know, protecting our youth from early tobacco use is not just a public health issue, it's an investment in their future. So we stand proudly with HOP Coalition in support and urge you to adopt this policy for the wellness of our community and youth.
Thank you.
Good evening. Thank you for the opportunity to speak with you tonight. I'm Maureen Busby, Mystic Valley Regional Tobacco Prevention Program Coordinator. I live in Melrose. While working on tobacco prevention for these past 14 years, I have gained firsthand experience in how the tobacco industry entices young people to try new, appealing, and very addictive nicotine products. Almost no young people smoke. That's a good thing. Tobacco control advocates worked for decades to achieve that. Meanwhile, the tobacco industry has also been hard at work, developing new products that don't look, feel, or smell like cigars and cigarettes. 10 years ago, it was Juul, with cool, sleek, discreet devices that looked like flash drives and came in a variety of flavors. Juul Labs was sued for deceptive advertising aimed at youth, and Massachusetts received a $41 million settlement. Since Juul, other manufacturers have entered the market with even more brilliant designs. Vapes that look just like highlighters, big-style pens that you can use to write or vape, and more recently, vapes with video games. Yes, you can play a video game while you vape. I have photos that I'll leave here tonight of recently purchased products that I'd like to submit the photos to the board. There's a vape device that looks just like a miniature guitar, a soft, squishy, neon-colored teddy bear, and a vape CD combo so that you can play music while you vape. What's next? This is the industry's playbook. Develop exciting new products that appeal to young people, because big tobacco, in order to continue to make billions every year, needs replacement customers. Those replacement customers are youth. Remember the industry's motto, hook them while they're young and you have a customer for life. That's a quote from industry documents. By the way, these new products are not a way for youth to quit. It's a way for youth to start a habit, which for many becomes a lifelong addiction, which in turn can lead to other substance use as well as serious health issues, huge financial burden, and even the loss of career opportunities. 6 communities in my region decided to protect youth by adopting this forward-thinking public health regulation. I encourage you to adopt this policy as well, which will start us on a path to end nicotine addiction and end youth use of poisonous products that cause so much harm, all in the name of profit. Thank you.
Thank you.
Hello, my name is Ida Girma. I work as a prevention outreach coordinator at Bay State Community Services, and I support the Greater Boston Tobacco-Free Community Partnership Program, which works to protect and prevent youth from smoking and vaping. During my first year in college, I vividly remember sitting in class, turning around, and unexpectedly seeing one of my peers vaping. Unfortunately, this wasn't the only time I saw it happen. It shocked me not just because it was bold, but because of how normalized nicotine use had become even in a place of learning. The tobacco industry continues to target youth and young adults through advertisements and flavorings, leaving them vulnerable and addicted to use these products anywhere and at any time. Just imagine, we could be part of a future where youth grow up never touching a cigarette or vaping device. It's our shared responsibility to take action and to build a culture that values health over addiction. Neighboring towns have already implemented this nicotine-free generation policy, and Hopkinton can too. Thank you.
Thank you.
I just want to remind everybody that the discussion like this will end at 7:15, so if you want to speak, do it now.
I'm Ross Merkin. I'm an oncologist, a doctor who treats patients with cancer, including cancers of the mouth and throat. I work at Massachusetts General Hospital and live in Melrose, Massachusetts. I'd like to take the next few minutes to speak with you about the devastating health impacts of tobacco use and to urge you to adopt the nicotine-free generation policy. In my professional opinion, implementing nicotine-free generation would be a major step forward in improving public health and saving lives in your community. More than half of the patients I care for have a cancer that was caused by tobacco use. These cancers are 100% preventable, but tragically many are not curable. Despite the best treatments we have, I have cared for far too many patients who have died from tobacco-related cancers. Many of these patients began smoking in their teenage years. It is well established that once someone becomes addicted to nicotine, it is extremely difficult to quit. Many of my patients have smoked for decades, often expressing a strong desire to quit for much of that time, but were unable to break the addiction. Tobacco can even cause cancer in relatively young individuals. I'm currently caring for a man in his 50s who began smoking as a teenager. He developed cancer of the voice box. To treat it, he underwent chemotherapy, radiation, and surgery to remove his voice box, leaving him with a tracheostomy, or a hole in his throat, and unable to speak with his mouth. Despite these extreme measures, his cancer returned within 6 months. It is now incurable, and he is likely to die before reaching 60. This diagnosis and the suffering that he's endured was entirely preventable. I see patients like him every day. Each case is tragic not only because of the suffering involved, but also because it never had to happen. Preventing young people from ever becoming addicted to nicotine is the most effective way to reduce the enormous toll tobacco continues to take. Preventing deadly cancers by stopping youth from becoming addicted to tobacco products is why I believe the nicotine-free generation policy should be implemented. By protecting young people today, we can save countless lives tomorrow. I urge you to adopt it and to protect the next generation from the preventable suffering caused by tobacco addiction. Thank you for considering my opinions, and I'd be happy to take questions following the conclusion of the hearing.
Thank you.
Ginny Chadwick, Columbia, Missouri, and Somerville, Massachusetts. I'm here doing my PhD, but a decade ago, I was on the Columbia, Missouri City Council, and I was one of the bill sponsors of a first Tobacco 21 policy to pass in the nation. And it was because of communities like yours here in Massachusetts that get the special opportunity to vote on this from the Board of Health level to pass policy to protect public health. Dr. Jacobs, as you said, there's nothing more powerful than the role of public health in our communities and to really make a difference. And in this current political environment, you guys have an opportunity to make public health policy that will have a huge impact in the community. And so I really encourage you to do so. I'm also the co-author of the Decriminalization of Tobacco Products document that's been co-signed by over 45 national organizations and statewide organizations. And in that document, we say that we shouldn't penalize the individual who falls prey to a multi-billion-dollar industry trying to addict our kids, but we should go after the industry who tries to addict these young people. And so when you think of nicotine-free generation, it is about regulating the sale of nicotine products. It is not putting the onus on the individual, but preventing the sale to those who will fall prey to the industry. So I encourage you to vote yes on this policy tonight. Thank you.
Good evening. Mark Gottlieb. I'm the Executive Director of the Public Health Advocacy Institute at Northeastern University School of Law, where I also teach. And I'm a lawyer and have been working around tobacco policy for many, many years. I've had the privilege of litigating against R.J. Reynolds and Philip Morris in cases involving very tragic circumstances where individuals have lost loved ones or someone has been horribly injured by the use of tobacco products and have to work with those clients. And these are just such terrible, tragic stories. On the other hand, I've also had the opportunity of representing the town of Brookline in their defense of the nicotine-free generation bylaw that was passed there in 2020, which was challenged by retailers and worked its way up to the SJC, and as I'm sure you're aware, resulted in a unanimous decision that demonstrated that in Massachusetts this is good municipal policy and constitutional municipal policy. And I was so happy to have had that opportunity and played that role. By the way, my organization will represent any community in Massachusetts that passes this policy and faces a legal challenge pro bono. And the reason I was so gratified is because this is a prevention policy. It's probably one of the most pure prevention policies you can imagine, because it doesn't affect any existing users. Existing users can continue to be sold tobacco products, as you know, and they can, have access to maybe less hazardous products than cigarettes, which are the most hazardous tobacco products. It doesn't affect them in any way, but it will really stop the cycle of addiction and disease, starting with the next generations. And I think that's really what this is all about. And I hope not to have to continue to represent the victims of the tobacco industry going forward. And I urge you to approve this amended regulation. Become the 16th community in Massachusetts to do this, and we're really creating this momentum for a movement here in the Commonwealth that I hope will reverberate far and wide. I have some written testimony in more detail and a guide to this policy that I'd like to submit, but I'm not quite sure.
Sure, you can just hand it off.
Thank you. Thank you. Okay, we have about 7 more minutes.
Good evening, everyone. My name is Neha Nainen, and I am here today not just as a concerned member of this community, but as a firm believer that the future of Hopkinton should be nicotine-free. For decades, big tobacco has profited at the expense of our youth, using manipulative marketing tactics and exploiting vulnerabilities. They package addiction in sleek designs, target our youngest generations, and disguise harm as a choice. But let's be clear, this is not a choice. It's a calculated strategy to hook our kids before they even understand the consequences. But those informed youth are against this. They advocate for a nicotine-free generation. On Thursday, in just 15 minutes, I got about 50 signatures from the high schoolers in support of a nicotine-free generation. We know the truth. Nicotine is highly addictive. It damages developing brains, compromises health, and leads to lifelong struggles, as we have heard. The numbers don't lie. Young people who start using nicotine are significantly more likely to become lifelong users. We cannot allow tobacco industries to dictate the health of our future leaders, athletes, artists, and dreamers. Hopkinton is a town that thrives on progress, community, and strong values. We rally behind one another, whether it's supporting a neighbor in need or cheering at the start of the Boston Marathon. Today, we stand for something even greater, the right of every child to grow up free from the grip of big tobacco. As I'm leaving Hopkinton, I'm a senior in high school now, prepared to graduate. I actually just came back from my job working with toddlers. And every single time I leave them, I ask, what kind of legacy do I want to leave? If we truly care about our youth, about their health and their potential, then we must take action. We must push for stronger policies, better education, and real consequences for tobacco companies that prey on kids. Together, we can make Hopkinton a beacon for change, a place where the next generation doesn't just survive, but thrives, without addiction, without manipulation, and without the chains of nicotine. Our future depends on it. Thank you.
Thank you.
Hello, I'm Zachary Rich. I'm a pulmonary and critical care doctor. I make my living and pay my mortgage by treating tobacco-related diseases. And I would invite you to support this NFG policy. I worked in the COVID ICU where we had every single one of our beds filled with a COVID patient, and after the vaccine, those beds very quickly became taken over by people suffering with tobacco-related diseases. I think you have an opportunity here to do something that I will never be able to do, and that is protect the children of Hopkinton and let them learn from the burden of tobacco diseases that my generation and my patients' generations had to bear. I think this is some of the most important work I do and would invite you to consider adopting the NFG legislation. Thank you.
Thank you. One more.
Hello, I'm Anthony Ishak. I am a resident of the town of Brookline, a pharmacist for a nearby hospital system, and I was a co-petitioner on the bylaw in Brookline that is now before you for your town to consider. I'm not sure that there's very much that I can add to the others, but I am just going to speak to you a little bit about the experience in Brookline and why this came to be. Working in healthcare, along with like the physicians and everyone you've heard from before, a lot of the focus is on treatment. This is one of the situations where it's out in the environment, and by prevention helps make our job easier. Everyone who's mentioned working with cancer and all the various disease states has talked about treatment. Well, we need to rely on healthier infrastructure. We rely on parks to help with exercises, safer environments for people to be in, and less toxic environments. And so that was part of the reason we came up with this in Brookline after the whole vaping pandemic, but before we knew about nicotine pouches. Prevention is key. Quote, Weinstein states, this is from an article, that smoking cannot be interpreted as a choice made in the presence of full information about the potential harm. Their study found that smokers underestimate their personal risk and often misperceive the nature and severity of tobacco-related diseases. Smokers, you can substitute for any tobacco or nicotine product here, often do not think carefully about risks from smoking when they first begin to smoke. Youth tend to initiate smoking based on the notion that it is a fun and exciting behavior. They often learn of the health risks from exposure after initiation through exposure to anti-smoking or anti-tobacco media messages about the hazards. Youth often repudiate their earlier decision of smoking and feel guilty for having ever started. In fact, 75% of users quickly regret starting, but there's only a 6% success rate with each attempt that often takes 6 or 7 attempts. This policy is particularly important in Hopkinton. Why? Well, the lung cancer incidence in Hopkinton is about 24% higher than the state average for a relatively wealthy and healthy community. This is despite a lower than average 8% usage rate. This is the addiction that keeps on taking even after quitting. There is also opportunity cost. Youth who use tobacco are not eligible for basic training for the military, cannot join our police and fire departments in Massachusetts for basic training. And in fact, a recent study in 2024
30 seconds.
Sure. Showed that teens who vaped had lower cognitive test scores in college than non-users and smokers. There's no financial cost that comes to the community of Hopkinton from tobacco use. Any money from taxes goes up to the state level. The only money made here is from permits. What is important is just a 1% decrease in tobacco use amongst the mass health population brings back $70 million in the first year or two. There's no reason for me to have to explain what is currently happening with the budget and the budget cuts, but this is important financially and important for health. A lot of things start in Hopkinton. This is probably one of the things that should end here in Hopkinton. So I encourage you to vote favorably for this health policy. Thank you for your time.
Comments.
Thank you very much.
We're done with the comment period.
The hearing is now closed. The board will now request a motion to either continue or close the public hearing.
Hear a motion?
I make a motion to close the public hearing.
Second?
Second.
All in favor?
Aye.
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 The board will now entertain a motion for a vote, if any, or discussion.
So, what's the actual process? You can vote on that.
You just say that the board has considered all of the materials and talked about and so forth and deliberations.
All right, so considering all the comments and the written documents in front of us, we would like to take a vote on the regulation. All in favor?
I can make a motion,
make a motion.
to approve the nicotine-free generation regulation as presented.
Second.
Thank you. All in favor?
All in favor?
Aye.
Aye.
The board will now make a motion as to when this should be effective as.
Sean?
No, it should be a January 1st date so that it's clear the year of birth.
January 1? Okay. Do I need a motion for that?
Yes, sir.
Motion for January 1 start date?
I make a
Jan- 2005, right?
no.
It'll go in effect.
Oh, it goes into effect.
Effect, yes. do you want to wait until January 1st of 2026 to have the vendors take this into effect? Or would you like it sooner than that?
Or we could propose to move with the permitting year. So that would be July 1st of this year for it to go into effect. That'll give them a month to
But the-
clear the product off the shelves and then the amendment that
All right,
But the date of birth
the date of birth is
is January 1,
2005.
2005, yes.
Yes. But the start. would
Start
be
date of this.
July 1st.
okay, so, do I hear a motion?
That it take effect July 1st, 2025.
Yes. Do you want,
Second.
all in favor?
Aye.
Aye.
Thank you very much. That concludes our hearing. Thank you all for coming and lending your voices.
Yes.
We appreciate that.
Thank you.
Thank you.